Ectopic pregnancy in IVF patients. So what is meant by ectopic pregnancy? When the pregnancy occurs in the tubes, it's called ectopic pregnancy. Normally the pregnancy embryo will implant in the uterus, endometrial cavity. It's called normal pregnancy. So normal incidence of ectopic pregnancy in general population is 1 in 30,000. In IVF pregnancy, it's 2% risk. So generally, so many people, they'll think that in IVF pregnancy, embryos will be dropped in the uterine cavity. So there must be less chances of getting ectopic pregnancy. But in some patients where there are intrauterine adhesions, any surgeries in the uterus, if the uterine contractility is more, the embryos will get dislodged and get implanted into the tubes, resulting in ectopic pregnancy. So, is it to worry about ectopic pregnancy? Yes, it's an emergency situation. So, the ectopic, it may rupture any time, causing life threatening to the mother. So, it's very, very important. And if there is any, so what causes ectopic pregnancy? If there is any unhealthy tube, damaged tube, swollen tube, or any surgeries or endometriosis, if there is any disturbed anatomy or any surgeries to the tube, and one more thing is infections, PID, pelvic inflammatory disease causing adhesions, lot of adhesions surrounding the uterus and the tube, and sexually transmitted infections like chlamydia, gonorrhea. So all these causes ectopic pregnancy. So what are all the symptoms? The patient, if the beta HCG is positive or urine pregnancy test is positive, if they complain any abdominal pain, abdominal discomfort, any spotting, bleeding, they should suspect, they should have idea about ectopic pregnancy, then they should consult doctor immediately. So if the beta HCG is positive, after 1 week we'll advise scan whether to check whether the pregnancy is in normal position or ectopic location. It's very, very important. So many people, they'll miss scan at that time. For some IVF patients, so we'll drop 2 to 3 embryos into the cavity. So some may dislodge and they will implant to the tube. So it causes one pregnancy in the uterus and one pregnancy in the tubes. It's called heterotopic pregnancy. So even it may be ectopic or heterotopic. So we need to tackle about ectopic pregnancy. It's a dead emergency. So doctor decides whether to go for medical treatment or surgical treatment or laparoscopy depending on your ectopic size. So this is very, very important. You should keep in mind about ectopic pregnancy. Even in IVF patients, there is chance of getting ectopic pregnancy.